Good morning. I'm Dr. Gilionescu, and today I want to present you an encouraging piece of news. According to the American Medical Association, which is the professional medical association of U.S. physicians, 96% of U.S. physicians have already been vaccinated against COVID-19. 96%. And even more than that, of the 4% of the physicians who have not yet been vaccinated, about half of them plan to do so in the near future. You know, we have in many languages, including in English, a saying that goes like this: you should practice what you preach. So as physicians, we oftentimes hear a criticism that unfortunately it is true, and that is we oftentimes tell patients to do things that we ourselves are not doing. There are still physicians who smoke. We tell everybody to exercise, and oftentimes some of us don't do that or don't do enough of it. We tell people to eat healthy, but oftentimes we don't do that, or even worse, we don't even know what eating healthy is. But in this case, I'm happy to report to you, and this is data coming from the American Medical Association, again, is not my impression, that the vast majority of the physicians in the US have gotten vaccinated against COVID-19. There is a lot of concern out there in the general population about vaccine side effects and possibly among some conspiracy circles, ideas that the government or the vaccine manufacturers or doctors are hiding something from us, that there may be some negatives to these vaccines that we just don't know enough of. And to be perfectly open, the main reason those 4% of physicians who have not been vaccinated cited as the reason that they have been waiting was exactly the uncertainty about the long-term effects. And now that we have been almost a year into this vaccination program, some of those concerns have been greatly alleviated. And as you have seen, a great majority of doctors have laid them aside. But to that idea that there may be something behind the scenes happening that is trying to do us harm under the cloak of a beneficial vaccine, I want you to sit down and think for a moment, if you belong to that category of thinking, or if you've been puzzled by it. Do you think that physicians living and practicing in the United States who have access to information about vaccine, who have been educated to understand how vaccines and infectious diseases work, including the coronavirus infection, who understand how our immune system is built, designed, and put together to process infection and vaccines and side effects. Do you think for a minute, seriously, that 96% of these doctors are so deluded that they ignore those dangerous, catastrophic, hidden side effects that some people talk about, and they say, you know what, I'm just going to go do this, I don't care about that? Or would you rather think that in their understanding, they know enough about the benefits and the risks of this vaccine, and they have made a determination for themselves that the risks are greatly outweighed by the benefits, and therefore they went ahead and did it? I will also say something else here, because I am a physician myself. Having seen the devastation that COVID-19 brings to human life everywhere in this world, having seen for a lot of these physicians who work in the hospitals, in the ICUs, having seen the devastation, the loss of life, the loss of quality of life due to long COVID that this infection brings in the lives of so many people, it would be very reasonable, I think, to surmise that they were the first in line to get this vaccine once it cleared any of the concerns they had. And exactly this is what we're seeing. I'd like to close by pointing you to the source of that saying that I used in the beginning, and that is, in this case, physicians practiced what they taught their patients. Interestingly enough, one of the earliest sources of that saying is in the Bible, in the New Testament, in the Gospel of Matthew, where Jesus talks to his disciples and to his listeners about the leaders of the day, the scribes, the Pharisees. And he had some harsh words to say about them. He said, they sit in Moses' seat. Um, and then he admonished his followers, Jesus did, and he said, practice and observe everything they tell you, these leaders, but do not do what they do, because they do not practice what they preach. Again, I'm the guilty party sometimes here with certain things that I practice and I don't always preach. But in the matter of the vaccine, I'm glad to report that I belong to that 96% category of doctors who have been vaccinated. And I encourage you to sit down with your doctor, with your primary care provider, and to discuss with them, is the vaccine a good choice for you or not, and make an informed decision. Stay healthy, and until next time, think critically